So today's talk will be on Shaokun's treatment of herniated intervertebral discs. Now, before I start, I'll just say that I'm happy to be representing the Academy of Source-Based Medicine, which is a little educational platform that I run with Michael Brown from Australia, who many of you probably know, and also Ivan Zavala. His Facebook, he's called Ivan Cloud. Probably you've seen him contributing a lot here and there. And we just run some courses from time to time, provide some educational content. And so you can check us out on Facebook and Instagram, as well as on our website. Now I'm also representing Purple Cloud, which is the publishing company that published this fine book that I'm promoting today. And you'll see that they also publish a lot of other great material. So a little bit about myself. Uh, I, s- I work in Taiwan, and I was originally trained in Taiwan as well, at the China Medical University. It's a post-baccalaureate program, 5 years. And then I had to go through the testing process to get certified as a doctor here, and then go into clinical practice. And so I've been practicing since I graduated in 2017. Now, I did my master's also at China Medical University, and it's a little bit different than I don't know how Australia is run, but like in America, like basically you get a master's, uh, your master's degree is your training for Chinese medicine, but in Taiwan, it's sort of like an extra thing that's specifically devoted to research. Now, I did textual literature research, and it was on basically on materia medica. You can read the little blurb here if you want any more information on that. Now, obviously, like I said, I'm representing Academy of Source-Based Medicine. And then the other thing is I've trained under Chen Jianguo, who is basically he's a Jingfang practitioner in China, and then his focus is kind of on pulse. So if I can, I'll hopefully weave in a little bit of information here and there on pulse throughout this lecture. Now in Taiwan, because I work in Taiwan, I originally trained also in acupuncture under basically this lineage that was started by someone named Zhou Zouyu. Um, and I learned a lot from that. It's a very palpation-based system, um, and very hands-on. And so that's had also a deep impact on the way I practice. And obviously, I should also mention that beyond this book that I've just translated, my first book is called Archaeology of the Chow Vessels. It was also published through Purple Cloud, um, sort of a niche book, but a niche book, but it's something I'm also pretty proud of because it's a very detailed look at the Chow vessels from the earliest literature and kind of going into how they were originally understood, how they evolved, what their clinical purpose was, how they tie into sort of the not meridian, the channel system in general from an aging perspective, and so on and so forth. It's a nice read. So if you have a chance, you can check that out through Purple Cloud. Now, I think I should probably just go through just this is the book that we published. It's called Jingfang Case Studies and Medical Treatises of Dr. Lo Shaokun through Purple Cloud. You can order through Purple Cloud if you like what you see today. Now, importantly, I should also mention that this book is available through China Books, as is I think my other book, Archaeology of the Chow Vessels. If they don't have it in stock. I'm sure they can access it for you. So, do support your local Chinese medicine bookstore. They do a lot of great work, and we're very grateful to them for allowing us to promote our book, and hopefully we'll continue to have great talks like this going forward. And then just to plug another book that's coming out is The Systematic Differentiation of Warm Diseases that just came out. That was translated by Alan Soar and edited by Michael Brown. Also, really a fantastic work. Really, a lot of work went into that. It's very difficult, but it's considered one of the classics. Some people sometimes call it one of the four classics of Chinese medicine. So it's definitely a really worthy addition to your library. Now, let's get into just talking a little bit about Lo Shaokun. Obviously, we're going to be looking at his case studies today, so we should know a little bit of background info on him. So he recently passed away, unfortunately. Um, he was a fairly healthy guy, so it was quite sad. I believe he passed away of pneumonia in 2023, potentially a complication of COVID. I'm not sure if that's true. But he is, he's a big name in China. He's really highly respected by Huang. And Huang, when he passed away, he published a whole article on him, and their styles are very similar. For people who know anything about how Huang practices. Now, the other really important thing you need to understand about Lo Shaokun is that his practice was very deeply influenced by Kampo. Okay, so I don't know how much people will know about Kampo from our audience tonight, but uh, one important thing about this tradition, particular tradition in the Kampo lineage in Japan, is that they don't uh, they don't put a lot of emphasis on theory. Rather, they put a lot of emphasis on the symptomatic presentation of the patient. And then on top of that, they put a lot of emphasis on what they call fukushin, which is, of course, just abdominal palpation. And so, really, they are the pioneers of abdominal palpation. I mean, now in the 20th century, in the 21st century, the Chinese are paying more attention to that, but they were doing it 200 years ago when no one was really doing that in China. And so the Chinese actually learn a lot about Fukushin from the Japanese. And one of the primary people to bring that tradition back to China is Lo Shaokun. And what's important about that is that he was just a full-on practitioner. I don't think he even really taught until much later in his life. And so this is all stuff that he was using day in and day out. And so you can be reassured that this is not coming from some sort of theory or anything like that. It's literally just his practice. And then, of course, just reading tons of Kampo literature. Now, the other thing about Kampo that's really important that I sort of just referred to, but is this idea of formula pattern correspondence. So again, they're not likely to discuss a lot of theory in their case studies. Mainly what they're doing is they're looking at the pattern that the patient is showing, their symptoms, and then they say, well, this grouping of symptoms closely matches this formula, right? So the formula pattern, obviously we're aware of this style from TCM also has this, but you could almost say that Kampo they kind of take it to another level almost. They're almost there's an almost like an obsessive quality to the refinement and detail that they put into their patterns. And this is something that Lo Shaokun also sort of inherited and you could say sort of transmitted to um, the West, well, west of Japan, so China essentially. But now, obviously, transmitting also to the West in general, to the Western Hemisphere. So this is good background that you can have on Lo Shaokun. It'll help you understand, have a little bit more context for the cases that are coming, that will now be forthcoming. Um, and I think as we get into the cases, you'll get even a better sense of how Lo Shaokun operates and what kind of logic he brings to the clinical sphere. So today, like we noted, we'll be talking about herniated intervertebral disc disease. And so um, just I'm sure this is such a common disease. I assume everyone knows basically what it is, but just for those who might not be so clear, we'll just give a brief introduction here. Uh, I wanted to do a disease that was relevant both for acupuncturists and for herbalists. I think probably the dominant modality, be it in Australia or be it in the United States or in Europe, South America, um, is probably going to be acupuncture. But when you come to Taiwan, for instance, or to China, it ends up being more ends up being more of an emphasis on herbal medicine for whatever reason. Now, uh, in my own practice, I'd say it's about 50-50. I think there's great things about both. And I do think, this particular disease is one where it benefits from using both modalities. There are a lot of great things that we can do directly through acupuncture for HIVD that I'm sure many of you are already, experts on. And so I thought, well, this is cool. This is an opportunity for people to see where we could further supplement our treatments with herbalism and get some good results. Especially because Lo Shaokun also, I mean, he does do some interventions. He does do some bleeding, some acupuncture here and there, but his main modality is herbalism. So you'll see how you can really treat what is essentially a musculoskeletal injury or disease with just herbs, which is kind of cool. Um, and so as you see in HIVD, we have this herniation of the this nucleus pulposus out beyond this fibrous layer, right? And so what happens is then it starts to push down on this nerve ending, right? And so that's what causes all of these symptoms. Sometimes it's due to this nucleus pulposus pushing. Obviously, the other aspect of it is there's inflammation and swelling in this region, and so that causes the neighboring tissues to push down on the nerve. Another situation, of course, is like a stenosis, which we'll also see actually in this talk, where you have, for instance, like a bone growth, which can also lead to a narrowing of the space that the nerve travels through, and also pushes down on the nerve, right? So, as you are all, I'm sure, very well aware, the symptoms of HIVD, it's a referred pain in the lower back, buttocks, thigh, calf, and foot. And then the important thing is it's often on one side. That's not always the case, um, but it does seem to happen more often than not, just because of what we see here with typically there's a herniation on one side. It's typically not going to be double-sided herniation, right? And so there's going to be numbness, there could be tingling, some weakness along the pathway of the nerve. And then there's also certain tests that they do, right? Physical tests like the leg raise test, crossed leg raise test. And then, of course, ruling out piriformis disease because the piriformis also the sciatic nerve in some people, it actually travels through the piriformis muscle, right? And so if there's some swelling there, it can also mimic the effects of sciatica. Now, I think HIVD, it's in some ways it seems like a small thing, but obviously it has pretty massive effects. It can lead people to be basically immobile, really severely affect their lifestyle. And then more so, they often have to take some kind of drug, right? Because it can be painful. So, a conservative treatment would be with like a non-steroidal anti-inflammatory. But then you can also have people, if that doesn't work, who end up being on steroids, or even in America, I'm not sure about in Australia, some opioid analgesics, which of course can be uh, very, very deleterious, right? I'm sure people understand why. And so if we can do something, if we can get in there, reduce pain, eliminate pain, we can massively restore lifestyle, massively help people in their lives with this HIVD treatment, right? Obviously, even allow them to avoid surgery is common. So this is a big deal. We want to be able to treat this and treat it effectively. So for our first case, we're going to be looking at what we call Taiyang type HIVD. So what's very cool about this book, this Lo Shaokun book, is that he doesn't just give you one case of how he treated HIVD. He gives you a whole slew of cases. So I just picked three cases, but I think there are maybe around seven in this book. And the reason he does that is he says, well, uh, there are a lot of different kinds of formula patterns that can present in HIVD. There's not just one treatment strategy. There could be a lot of treatment strategies. So he's going to show you, and he breaks it down typically by the six conformations in the Shanghan Lun. So originally I had the name of the formula written right at the top, but I think you can, as you read the case and stuff, you can sort of try to guess for yourself how you would treat this. Think about how you yourself would treat this this patient. I think that's a great way to approach case studies in general. Kind of get yourself in the clinical mode as you're reading. Um, so this patient is 50-year-old male, and he's had chronic intermittent lower back pain for 10 years that's intensified recently. And there's a sinking pain in the lower left back, pain and soreness in the left gluteal region, and intermittent claudication. So he was diagnosed with an L4-5 HIVD, as well as this degenerative lumbar spinal stenosis, which I show here, a little diagram here. We've got a bit of a bone overgrowth. So on top of there being this herniation, he's also got bone overgrowth. So sometimes people will come with, uh, you know, multiple problems occurring in the spine, right? Now, let's look at the symptoms here. The patient is gaunt with a pallid complexion. He complains of dull pain and numbness in his lower back and legs, inability to stand up straight, and limited bending mobility in the back. Now, he complains also of occasional aversion to wind, heat effusion, spontaneous sweating, vertigo, poor appetite, sleepiness, overproduction of saliva in the mouth, sloppy stools, scant and yellow urine, and slight edema of the lower limbs. Okay, so that's a nice full um, selection of symptoms that we have there. Now let's look at the signs. So he's got a pale red tongue with a thin white moist coating. He's got a sunken, moderate, and forceless pulse. And on abdominal palpation, The abdominal wall is thin. The abdomen is flat and tight. Palpitations can be felt at the navel. The lower abdomen is distended and full, and there's pain upon pressing at the lower back in coccyx, right? And so I'm just going to go through the case first, and then we'll have a little bit of a discussion afterwards, just so we can maintain sort of the feeling of like a clinical flow here. So be thinking to yourself, how would you treat this? Maybe you can think about it from an acupuncture perspective, also from an herbal perspective if you do herbs. So let's look at how Lo Shaokun diagnosed this issue. So he said this is a combination Taiyang channel and bowel disease. Construction and defense are disharmonized. Wind, cold, and damp have congealed in and block the Taiyang channel, and there's room congestion in the Taiyang bowel. So he's going to use a modified Guizhi Xinjia Tang plus Wuling San to harmonize defense and construction, disinhibit water and damp, and dispel wind and cold. So now we have the formula under here. So we have 桂枝、当参、白芍、大枣、草白术、茯苓、竹林、泽泻、炙甘草、砂仁、生姜. So we have basically this first part here is part of the core of this Guizhi Xinjia Tang. Guizhi Xinjia Tang has a higher dose, as you can see, of baishao. It's Guizhi Tang plus a higher dose of baishao, right? And then on top of that, you add dangsen, like rensen, dangsen, but he's using dangsen here. And then, of course, it also has sengjiang, which is not included. He wrote that further down. Now, the other formula you have here is Wuling San, right? Which is Baizhu, Fuling, Zhuling, Zexie, right? Plus Guizhi. And then, like I said, this Gancao and Sengjiang, they're part of Guizhi Tang. And then he has Shaoyin, which he doesn't really discuss, but that's not part of either of these formulas. So now let's look at the results. So after taking the herb, the patient reported increased urine volume, decreased aversion to wind and heat effusion, and improved appetite. However, there was no noticeable change in the back and leg pain. I targeted this unimproved symptom by adding 10 grams of Fuzi to increase the cold dispelling and yang warming function of the formula. After taking another 5 packets, the patient reported a decrease in back and leg pain, but he still had significantly limited bending mobility. So the above formula hit the mark, so I prescribed another 5 packets and performed massage and wet cupping on sensitive areas of the lower back and coccyx to assist the flow of qi and blood. Now, after another 3 weeks of using these modifications, all symptoms resolved and the tightness in his abdomen was reduced. However, he still had significant weakness and tiredness in his legs upon exercise. So I advised the patient to use moxa daily at Du2, GB30, and RN4 to gently warm and supplement yang qi and restore function. After using that moxa for a month, he made a complete recovery. On a follow-up 4 years later, the patient reported that he did not have a relapse of pain and sometimes just felt some slight discomfort in his lower back after performing heavy labor. So all told, this is probably somewhere in the range of 3 months, 2.5, 3 months to get rid of what's essentially a very debilitating illness. So obviously it didn't happen in 1 week. Also, at the beginning, there was actually not the first time around. He sort of didn't see any improvement, and so he sort of modified the formula a little bit, and then kept working, and had this person coming back week after week for a couple months. So we can see this is not the kind of disease where you just one treatment and it's all set. It takes some time, right? Now, what I'd like to focus on here with this is something that I think it's very, very important in clinic. And honestly, as someone who, part of what we do at ASBM is we advise people on cases and stuff like this. It's something that I see as a little bit of a like a gap, I think, in the education. And so let's look at this quote from Lo Shaokun. What he says is the Taiyang section of the treatise on cold damage has the most detailed analysis of wind, cold, and damp impediment. Taiyang is the outer fencing of the body and the first to come up against wind, cold, and damp evil as it tries to infiltrate the body, inducing a holistic reaction as it passes from the channels to the bowels and from the interior to the exterior to the interior. So why I brought up this quote is because I think in our traditional training, it's not that common for us to consider Taiyang disease or what you could call exterior contraction in the context of this back pain, and especially like a chronic back pain. I think a lot of times that's going to come under the umbrella of like a kidney deficiency or maybe like a spleen deficiency or something like that. Obviously, this person also has that spleen aspect as the kidney aspect, but very, very important aspect that is seems to just get passed right over is the involvement of Taiyang. When you think about Taiyang disease in the Shang'an Lun, think about the formula, for instance, Tang, which right in the description of the presentation talks about back pain, right? It's one of the first things. And it over time people have theorized also that, well, Taiyang, it's like the pengguang, the urinary bladder channel, right? So it travels down along the back and so it makes sense, right? But why does this get overlooked? I think the reason why it gets overlooked is A, because we have sort of a preconceived notion about what we think chronic disease, what what would cause chronic disease. And oftentimes we think that has to do with uh, like what we would call three yin, like for instance, liver, spleen, kidney, or diseases, right? Dysfunction. And we wouldn't think so much when we think about an exterior contraction, we think of, the person has a cold, they have a fever, and so on and so forth. But what the Jingfang teaches us is that throughout the entire duration of any illness, we can always have a Taiyang component. And I hope, if you come away with anything from this lecture that you'll remember that and in the course of your treatment and your clinical practice. And so why would this get passed over? Well, part of it is that we might just, when we hear it's a chronic disease, we might just skip things that would tell us that this is an exterior contraction. If you see from his intake, he's very, very clear about asking very important questions about exterior contraction. So he talks about, hey, do you have aversion to wind or to cold? Do you have heat effusion? Now, this is not, I'm surprised that the person has heat effusion. That's not, honestly, in a chronic tongue disease, I don't see that happening very often. But he says it also has spontaneous sweating. So asking about sweating, asking about cold aversion, asking about sensitivity to hot and cold, right? The person is averse to cold. It's not necessarily Shaoyin or some sort of like yang deficiency. It could be also a Taiyang or an exterior contraction issue, right? So that's something to really pay attention to. Um, and then sweating, of course, is also very important. The other things that we can look for when we're testing, when we're looking out for this exterior contraction, things like headaches, right? Headaches often are related to exterior contraction, tightness in the neck, right? And so these are all things that we should ask regardless of it, if it's a chronic disease or if it's another very important one is stuff to do with the nose. Is there um, some sort of rhinitis? Is there a stuffy nose? Does the person have some phlegm in their throat, which might be like also having to do with their nose? Do they have a cough? Stuff like this. Um, we can't discount that because that absolutely can play into the uh, the mechanism of this issue, and it certainly does in this case. All that happened was that there was an exterior contraction, but this pathogen, we could say, this cold wind pathogen, did not get expelled in time, and so it sunk a little bit deeper while still being partially in what we could call sort of like the domain of Taiyang. Because Taiyang has that, as he says, it has that aspect to it. You have exterior Taiyang, but then he also says like you can have the bowel aspect, right? Where it sinks, the pathogen sinks in and it starts to affect bowel function, and so it can manifest as something like Wuling, which obviously often works with the urinary bladder, or it can, Tang is another one where it sinks into essentially the blood layer. So yeah, this is just something that I really, really want to drive home, because you think it's not something that people pay enough attention to, and it's a very, very important aspect of treating HIVD. Um, you can get partial results, you can get full results just treating Taiyang. Just using, for instance, Tang, or using, for instance, Xinjia Tang, Wuling, it's possible to get good results just with these formulas. So we absolutely have to be asking these questions. So that's why I singled out this quote talking about sort of the nature of Taiyang, how it stretches from the exterior into the interior. We can't forget about that. Obviously, an impediment, which is impediment disease, which is things like arthritis, things to deal with the bones, any kind of pain. Impediment is due to wind, cold, and damp, right? This is what the inner canon tells us. Wind and cold essentially are associated with Taiyang, right? They're also associated with other channels, but they come via Taiyang, and then they sink into the body, right? And so from Lo Shaokun's perspective, what he's doing is he's looking to find a formula pattern, right? So he notices that this patient has a thin build, pallid complexion, aversion to cold, heat effusion, spontaneous sweating. Well, right there, that's like the canonical line to the Guizhi Tang, right? And then on top of that, these ideas of the flat abdomen with tightness and rigidity being a Guizhi Xinjia Tang pattern, right? Because Guizhi Xinjia Tang, like we said, it has Baishao in it. Now, Baishao is sort of from like a Western perspective, it's kind of like a muscle relaxant. And so oftentimes we see in any kind of Baishao pattern, we'll see a rigidity to the abdomen, be it Guizhi Xinjia Tang, which has a higher dose of Baishao than Guizhi Tang, or Xiaojianzhong Tang, which also has a double dose of Baishao, or even something like Sinisan, which has Baishao in it as well, or Da Chaihu Tang. All of these formulas that have Baishao, they'll all have a certain rigidity to the abdomen. And so again, we shouldn't immediately skip to, we feel that rigidity, for instance, especially like on the right side of the abdomen, you might think, this is, we might immediately skip to like a Sinisan. But we shouldn't forget there are also these Baishao patterns within the Taiyang chapter, specifically this Guizhi Xinjia Tang. Now, he says, after several years of lower back and leg pain, the patient had significant qi and blood deficiency. So this is important to think about. There is, when we have a chronic disease, there is going to be a certain amount of depletion of qi and blood. We can see that in the patient. They had this sunken, moderate, forceless pulse, all things that we would think about not only in terms of Taiyang, but in terms of Taiyin, right? And so, especially that moderate pulse. And so, uh, this is why, despite him having these external contraction signs, you couldn't simply expel the pathogen and hope to do well because the patient already doesn't have sufficient qi in blood to expel the pathogen. So in such cases, you have to add on um, some herbs like, for instance, rensen or other herbs that can strengthen the patient, right? So in this case, Guizhi Xinjia Tang, it also uses this dose of rensen, or in this case, it uses dangsen, right? To strengthen the patient's ability to uh, push out, to expel that pathogen, right? So it's not just Guizhi Tang, that would not be enough. So he shows the line here. If after sweating there's body pain and a sunken and slow pulse, Guizhi Xinjia Tang is indicated, right? Now, sweating here stands in as this sort of, what does it mean? It's like sweating, we're depleting the body. We're depleting the body of its resources. And so in such situations, if that sweating did not expel the pathogen, um, then we have a situation in which the patient is depleted, but they're still fighting against the pathogen. We can't just use a simple exterior pattern formula like Guizhi Tang or Mahuang Tang, Gegun Tang. We have to also supplement at the same time. That's why we use Guizhi Xinjia Tang. Now, on top of that, this patient also had some other signs, right? They had umbilical palpitations, distension in the lower abdomen, um, inhibited urine, lower leg edema, moist and white tongue. And so this is all this like water amassment, this water metabolism issue not being resolved in the context of an exterior contraction. So in such cases, Wuling sun is a good formula for that. So he first prescribed this Guizhi Xinjiatang plus Wuling san to accomplish everything that we talked about here. And he says this is what's called unblocking yang via disinhibiting urine as opposed to warming. So you could unblock yang by warming, right? You could use Sini Tanga, you can use any sort of warming and acrid formulas. But here we're targeting the pathogen specifically. The pathogen in this case is this water. It's manifesting in these palpitations, in the tongue, in the edema, all these things. So it's better to just attack the pathogen in question. And that allows us to unblock yang because yang is being blocked by this water, right? And so this is the first case. Again, you see in this case, what he does is he zeroes in on formula patterns and formula pattern presentations. And he just treats exactly according to that, exactly according to whatever he thinks the formula pattern is. Looking a lot at the abdomen itself, drawing a lot of information from the abdomen, like we say, umbilical palpitations. That's something that comes from the Shanghan Lun, talking about in a thin patient who has palpitations below the umbilicus. They'll have a Wuling San pattern, and so on and so forth. All the things that we talked about here. And so this is a nice, simple, elegant formula um, that got the job done. And we see this use of both moxa, acu, and herbalism to strengthen and to strengthen our treatment, right? And so we're attacking locally and also addressing the entire mechanism of this patient at the same time. And so this is a great example to start us off. So let's have a look at our second case study here, which is again a case of HIVD. And This time you'll note it says it's a Shaoyang Taiyang combination disease type. So the first one was sort of like a Taiyang Taiyin. This is a Shaoyang Taiyang. Now, importantly, it's still an exterior contraction. So we can see already how prominent exterior contraction is in treating HIVD. So this patient sustained a blunt force injury. It's a male, 35 years old. This was 2 years ago, and that caused him pain and numbness in his lower back and legs. Um, he was found to have spinous process subluxation, pain upon pressing around the S1 spinous process, pain upon pressing at the sacroiliac joint, and a positive left straight leg raise test. And so it was found he had a bone bridge at the L5 S1 disc, and he was diagnosed with HIVD with this joint subluxation. Now let's look at the patient's symptoms. So the patient is tall and thin and grimaces with pain. He complains of coldness, pain, heaviness, stiffness, spasming, and reduced sideways mobility in the lower back. Additionally, he reports aversion to cold, hot agitation, bitterness in the mouth, dry throat, nausea, and scant and incomplete urine. So let's look at the signs here. The tongue is pale red with a thick, yellow, greasy, moist coating. The pulse is sunken and wiry. Now comes the diagnosis. This is a case of damp wind and cold lodging in Taiyang, infiltrating from the exterior to the interior, and subsequently damaging Shaoyang, leading to what he calls conformation combination disease, combination disease. Treatment should focus on resolving the flesh, expelling wind and cold, harmonizing Shaoyang, and eliminating dampness. So you can think based upon that, what kind of formula would you be using for this patient, based upon their symptoms, maybe a little bit based upon this diagnosis. So Lo Shaokun is going to use, again, a very simple, elegant formula, just Chaihu Guizhi Tang plus Shenzhuo Tang. So that's, again, if we can kind of break this down here, we have Chaihu Huangqin, right? Banxia, Gancao, Shengjiang, Dazao, okay. From and he doesn't use, it looks like he doesn't use Renshen or Dang. Oh yeah, he also has Dangshen. So this would be the core of Xiao Chaiwu Tang, right? And then you add on to that Guizhi Bai Sao, and you have Chaiwu Guizhi Tang. And then he uses Shenzhuo Tang, which is Baizhu, Fuling, Ganjiang, and then plus Gancao. And so Shenzhuo Tang, it literally means like something glomming onto or accruing to the kidneys, but it's essentially it's a formula where the primary symptom is this pain in the lower back that has to do with dampness. Now, additionally, he needled gallbladder 30 on the left side. Okay, so after 3 packets, all symptoms improved, and after 5 packets, the patient's left leg numbness diminished. This was clearly the right formula, so I prescribed another 5 packets and performed massage and acupuncture. On his, let me see, okay, get rid of this. On his 3rd visit, the patient reported that all symptoms had improved. So he added Shising to reinforce the cold dispelling and channel warming effect of the formula. After using modifications of the same formula for a month, the condition completely resolved, and on a follow-up, there was no discomfort in the lower back. So, um, so again, he's just using basically an exterior contraction formula with just maybe two herbs to work on that dampness. Again, like we said, impediment disease, wind, cold plus dampness, right? So if you eliminate those three things, you have a good chance of treating this disease well. Now, you'll notice that in both of these cases so far, towards the end of treatment, he added another sort of strong, warming, acrid herb. In the first case, he used Fuzi. In the second case, he added Xixin. So I think the timing there is kind of important. In the first case, he didn't use the Fuzi until he had sort of adequately cleared the exterior contraction. And in this case, he doesn't really use Xixin until, again, he's sort of cleared that Shaoyang and that Taiyang sort of component to the disease. You can imagine if you added Xixin too early, potentially, you could cause sort of like a flare up of heat because Shixing is quite warming, it's quite effusing, and so we often say it can cause that heat to sort of surge to the surface, and that could manifest in a lot of ways. It could be, a dry mouth, it could cause acne, all sorts of things could occur. And so I think it's sort of a wise move to first, I think in general, when we're treating, we want to, unless there's what we would call like a concomitant Guizhi, Taiyang and Shaoyin condition, something like Guizhi Fuzi Tang, where the patient simply is just too weak to effuse the pathogen on their own with just a Taiyang formula. If they still have some amount of strength, that you feel their pulse, it's still fairly strong. You feel their abdomen and it's not very loose and weak feeling, then we can first just do an exterior contraction release. So using just clearing out Taiyang, clearing out Shaoyang. That way, if there's still some pathogen lodged deeper inside, we can treat that afterwards and allow that to effuse sort of more smoothly without causing any sort of side effects, right? So those are things to point out. Now, Shixin is a very important herb in treating HIVD. Sometimes you can use it right away. For instance, Mahuang Fuzi Xixin Tang is a very, very important formula. Mahuang Fuzi Gancao Tang is also very important. Both Fuzi and Xixin are strongly warming. They strongly warm sort of the lower jiao, you could say the lower burner. And then at the same time, they also have Fuzi especially has this supplementary effect, supplementing yang. Xixin doesn't supplement yang quite as much. It's more just powerfully effusing, powerfully reaching deep into the interstices of the body, rooting out those deeply rooted cold and damp pathogens and pushing them out to the surface, right? So these are both important herbs to keep in mind. Now I know in Australia you can't use foods, and you can't. I don't believe you can use Mahuang. So in the next case, I'm going to go over some other herbs that you can use in place of Mahuang and Fuzi that I think are. It's hard to replace Fuzi, but I think they'll also be fairly effective. So, Lo Shaokun says that the Shi family traumatology lineage likes to use Chaihu in these external injuries, if there's internal damage subsequent to external injuries. And they say when you're treating the blood, you should also treat qi. And when treating qi, you have to course the liver. So it's important to use Chaihu. Now, Lo Shaokun has his own idea about this. He says um, when he's treating HIVD, he's treating it basically when he's using Chaihu, his idea is to allow the chi dynamic to outthrust evils within. That's the important part here, right? So Chaihu, it has this ability because it sort of courses the triple burner, right? It opens up these membranes that regulate, mediate between the interior and the exterior of the body. So it allows these evils to outthrust outward. Right? We just talked about Shixing has that power to push the evil outward. Well, if the mid terrain, right, the Shaoyang, sort of the triple burner, the membranes are not cleared, it's going to be difficult to thrust outward. So that's why Chaihu can be very important in treating this disease, because oftentimes in HIVD you have dampness or cold that's sort of lodged pretty deep inside. And so for that reason, Chaihu formulas are quite important and shouldn't be overlooked when we're treating HIVD. And so that's essentially it for this formula. He didn't go too much into why he chose these, but basically it's fairly simple. The patient had hallmark signs of Taiyang-shaoyang, right? So they have this aversion to cold with heat, hot agitation, sort of that if someone is both averse to cold and heat, oftentimes that's a good sign of Shaoyang, right? Bitterness in mouth, obviously, again, clear sign of Shaoyang, and dry throat, right? These are the hallmark signs. With a koku yangan mushin. So that's like dry, bitter mouth, dry throat. Sometimes there's also going to be some sort of vertigo, which this patient does not say they have any vertigo, but that's often also a sign. Nausea is also a very hallmark sign of Shaoyang. Now, the scant and complete urine is more of this sort of this fluid metabolism issue, and so that's addressed with the Shenzhuo Tang. Now, up above here, we have this coldness, pain, stiffness, is all having to do with Taiyang, aversion to cold, right? Pain in joints is often a sign of either Taiyang or Shaoyin. So these are good to know. Obviously, heaviness can be more of like a damp issue. Now, another interesting thing here is he says reduce sideways mobility, right? In both, I think Chaihu Jialonggu Muli Tang and in Chaihu Guizhi Ganjiang Tang, you have this thing about not being able to move sideways. Both of those are Shaoyang formulas, right? So you can think about, well, the gallbladder channel runs up the side of the body, right? So if you have some sort of tightness in that area, it's obviously going to limit your sideways mobility. And so this also translates into the Shanghan Lun and their description of Shaoyang. Now, in terms of Shaoyang, we also have another really important diagnostic tool available to us, which is, of course, this Fukuxin, which we talked about, Lo Shaokun being sort of a master of this abdominal palpation. And so Chaihu Guizhi Tang also has some very distinct features from a abdominal palpation perspective that we can also look at here. So the nature of Chaihu Guizhi Tang, first and foremost, is that it combines obviously Xiao Chaihu Tang abdominal palpation features, and Guizhi Tang. So in terms of Guizhi Tang, we expect there to be some rigidity in the rectus abdominis. We expect also the abdomen to be a bit thin, in terms of you can push down and immediately get right through to the inner organs. Now, also another sort of aspect of Guizhi Tang is that despite there being rigidity in the rectus abdominis, oftentimes when you push down further, it's a bit weak. So there's a bit of that contradiction in the Guizhi Tang pattern. Now, in terms of the Chaihu, Xiao Tang abdominal palpation presentation, you would of course expect to see some pain or soreness when you push below the ribs, or even at the bottom border of the ribs, especially on the right side. Okay, so you really want to focus on that right side. A lot of times the left side will be negative. And then the other thing that you can look for is you can press on the liver 14 and gallbladder 24, these mu points of the liver and gallbladder. These are also really good points. And oftentimes those will also be positive in a Shaoyang pattern. Now, something that's a little bit different for Chaihu Guizhi Tang that you don't necessarily see in a Xiao Chaihu Tang pattern. You can see it, but it's not as common, is pain below the substernum. And this is discussed directly in the line for Chaihu Guizhi Tang. And so that's another place that you want to look. Now, sometimes you can press directly on the substernum area and try to find a reaction. Sometimes that's what you call like an objective sign. Sometimes it might be subjective, as in the patient themselves might feel some fullness, or some glomus below the heart, so to speak, in the substernum. Now, another way that you can elicit some response here is by what we call rib knocking. So it's where you knock on the side, on the flank of the ribs, and then when you do that knocking, it elicits some discomfort at the substernum. So that's another really interesting one for Chaihu Guizhi Tang. There are some people that say any Shaoyang pattern might also be positive for this rib knocking, but there are also people who say for Chaihu Guizhi Tang, that's a really strong sign to look for. Now, of course, finally, beyond palpation, we can also look for these other signs that occur in the line for Chaihu Guizhi Tang, which are nausea. Of course, that's also a Shaoyang thing, but it's again noted very specifically in the Chaihu Guizhi Tang line. And then another one that's really interesting is joint pain is also noted right in the line for Chaihu Guizhi Tang. So those are two very important aspects of the Chaihu Guizhi Tang formula pattern. Obviously, this joint pain, it shows that why this would be so applicable in the case of HIVD. So really simple, very sorry. So very simple formula, and then just staying with it, because the thing is, he treated this patient for a couple of times with many packets, at least 3 times. And so this was fairly fast, but you can see you can get a good result in a decent amount of time if you target the symptom pattern effectively, as Lo Shaokun has done in this formula. So really, we just cannot forget about exterior contraction. Is again just the moral of the story here. So now we're going to get into a Shaoyin type HIVD. So let's move on to the third and last case here, and this case is going to be a Shaoyin type case. We're not going to disclose the formula right away. Hopefully we can think a little bit about what that formula might be. But just to show that we're going from basically a Taiyang type to a Shaoyin. And we'll talk a little bit more about what that means in a second. So this is a female, 30 years old. And again, this was an accident. This was this HIV occurred after an accident, sort of subsequent to it. And the person was later diagnosed with this HIVD and this lumbar recess stenosis by CT and X-ray. And so we can see again that basically what we're getting here is this like overgrowth of bone into this cavity where the nerve is shooting out, right? And so this can cause, again, some this numbness and pain along the sciatic nerve, and also pain in the back, right? And so, as always, Lo Shaokun kind of talks about you've just got to go into these situations, these cases with an open mind. You shouldn't be uh, immediately thinking, oh, okay, this person has this back pain, so we're going for a kidney or whatever, right? So again, we're just going based upon what we see with symptoms. So the patient has this slightly overweight build, appears fatigued and in pain, has a sallow and dry complexion. The lower back is rigid, painful, and immobile, and the lateral portions of both legs are cold, numb, painful. The lower legs are edematous. She complains of rhinorrhea, diminished sense of smell, sloppy stools, and inhibited and frequent urine. And this is remember, this is a patient who's only 30 years old, right? And notice right away, we have this rhinorrhea, right? We were talking about how that's an important sign of what? Exterior contraction, right? So we'll get back to that in a second. Now, the signs, the patient has an engorged tongue, dark and pale with a thick white watery coating. The pulse is wiry, thin, weak, and slow. And then the abdominal palpation is quite interesting for this case. So Low notes that the abdomen, while it's overall lax and soft and gives way with pressing, the muscles around the navel are rigid and pressing radiates pain to the back. Okay, so we'll talk about what that might mean in a second here. So here's the diagnosis in the formula. The diagnosis, the patient has Shaoyin disease against the backdrop of a Mahuang constitution. The yang and blood are deficient, and wind, damp, and cold have lodged in the back and legs, right? That wind, damp, and cold being the hallmark signs of impediment disease. So the treatment should focus on warming yang, dispelling cold, and disinhibiting dampness. Just the same as basically the other two cases, but just targeting different layers essentially. So the formula in this case is a formula that's not going to be very helpful for people in Australia, but we'll try to find some stand-ins in a second. So this was Mahuang Fuzi Gancao Tang plus Fuzi Tang. So again, we have just this Fuzi, this part right here, sorry, not including Mahuang. The first five herbs, right, are Fuzi Tang, just straight Fuzi Tang, Fuzi Baizhu, Wuling, Dangshen, Baisao. And then the last three are the Mahuang Gancao Tang. So we also did some bone setting to correct the subluxated lumbar vertebrae and wet cupped at painful sites on the lower back and legs. So we've seen him doing a lot of wet cupping at painful sites. So that's something to think about incorporating in your practice. You'll note this person is ostensibly kind of deficient, but he's still doing that wet cupping due to there being significant pain. See if I can get rid of this. Okay. And so what are the results? So after treatment, the symptoms improved. Then he added Shixi and Dangui to penetrate into the yin and blood layers and prescribed another 5 packets. So now we've got basically Mahuang, Fuzi, Xixing Tang, because you're adding Xixing. They're also adding Dangui. Um, After using the same method for another 2 weeks, the patient felt warmth return to her limbs and her edema was diminished. Urine disinhibited, stools became formed, and the lumbosacral and lower limb pain gradually subsided. So then he pivots to basically a formula that's like a slowly supplementing yang while also supplementing yin and yang. So just working on this patient's constitution while also lightly effusing pathogen. So that's this formula called Yang He Tang. Now you'll note that it has a very high dose of Di Huang at 30. Lu Jiao Jiao, instead of using Fuzi, is using Lu Jiao Jiao for the yang deficiency. There's also Rogui for yang deficiency, right? And then you have Baijizi and Seng Mahuang are both acrid herbs that can reach into again, this lower burner. We could say basically in the Chengjianguo system, you could say like the left shi, and below the left shi um, are where you might feel some tightness, some wiriness. You might feel the pulse being a little bit longer at that position. And Baijizi and Mahuang will be working on that area, right? So that's sort of like a long-term thing that he's doing to help the patient over a course of many months. And essentially the patient improved after that, right? So one thing I'd like you to notice right away here, because he doesn't really talk about it, but I think it's important, is his adding dangui, and he says to penetrate to the yin and blood layers. So how does he know that the yin and blood layers have been affected in this case? Well, he does say that the blood is deficient, right? And so maybe, I don't know, the pulse is thin, so you could say that's a part of it. The tongue is pale, but a pale tongue and a thin pulse can also be signs of yang deficiency. So that's a little bit difficult on its own. But one thing that's quite interesting is that he has this abdominal palpation, right? And he says the muscles around the navel are rigid and pressing radiates pain to the back. Well, this is a very famous abdominal presentation for Dangui Xiaoyao-san. Okay, this is noted in one of the most important books on Fukushin. It talks about Dangui Xiaoyao-san having this quality. If you press around the navel, you can get pain radiating to the back. Now, in this formula, you already have a lot of Dangui Xiaoyao-san. You have Bai Sao, right? And then you have let's get back to the formula here. You have Bai Sao, which is in it. You have Wuling and Baizhu, which are also in Dangui Xiaoyao-san, right? And then you add this Dangui. So now you're getting pretty close to Dangui Xiaoyao-san. You're just missing the Chuanchong and Zexie. So I think that's where he was going from eventually in this. Lo Shaokun has something that he says, first establish what the formula pattern is, then treat according to that. If you get results, then you can think about what the mechanism might be. If you think about the mechanism too early, you might be led astray by various rationalizations and reasoning. And so that's essentially what he did here when he kind of went back and thought about it a little bit more. So let's see how he discusses this formula. So he said the patient had a Fuzi pattern, a Fuzi pulse against a Mahuang constitution. So for him, this is sort of like a Huang style of treatment, right? Looking at a constitution, a formula pattern constitution, right? So this patient was overweight, averse to cold, dark and dry complexion, has tendency to develop edema, dry skin with no sweating. So basically a patient that has this retention of fluid combined with exterior contraction is like this Mahuang constitution. Now, he also has a Fuzi pattern, which says a dark complexion, aversion to cold, cold limbs, pain and rigidity in the lower back. Of course, I don't know about this dark complexion aspect. I think a lot of Fuzi people can be quite pale, but that's his point of view. So based upon that, he said the patient's constitution pattern combined with the principal Shaoyin symptoms of this faint, thin pulse, right? Again, so thin can also be Shaoyin, like a yang deficiency pulse, and desire to sleep. So he prescribes this Mahuang Fuzi Gancao Tang plus Fuzi Tang, right? And so he goes on to say Fuzi Tang is known as a Shaoyang formula that consolidates the root and protects from exterior evil invasion. It treats Shaoyin disease with body pain, cold in the hands and feet, and joint pain, and lack of thirst with aversion to cold in the back. So this is another really important sign here for Fuzi Tang. Again, we're going to talk about how to use something other than Fuzi for our Australian friends here. But Fuzi Tang, a lot of people like to base their diagnosis on this aversion to cold in the back. So to get that, you have to ask about it. You have to say, does your back feel cold? That's a big sign for Fuzi Tang. Okay, and one that could appear quite frequently in patients with HIVD. So it's a really important one to ask. It's a direct formula that discusses pain in the back. There aren't that many of those. So it's good to know. Another one is Shenzhuo Tang, and of course Gugun Tang as well. So let's move on here. Now, from a theoretical perspective, Kechin, who is like a Qing Dynasty era sort of Jingfang commentator, he said Mahuang Fuzi Gancao Tang and Fuzi Tang are both Shaoyin exterior contraction patterns. So basically, what is a Shaoyin exterior contraction? It's basically there's an exterior contraction, but the body doesn't have sufficient resources to fight it off, right? And so as a result, the pathogen can move deeper into the bone, into the lower burner, which is exactly what happens in this HIVD, right? You typically get this cold, damp, and wind accumulating in the lower burner around this L4, L5 area, right? And so that's what he says. This cold penetrating from the yang exterior into the channels. So and that caused this body pain, joint pain, aversion to cold on the back. Again, we said of the Fuzi Tang and the sunken pulse are all the result of penetrating from the interior into the bones. And so very importantly, Mahuang and Xixing target the cold penetrating into these deeper areas, right? So we often think of Mahuang being an herb that can treat the exterior, but it also has this ability to penetrate deep into the lower burner. So there's a saying about Mahuang that Mahuang can suck up kidney water. And so that would be, in this situation, it would be talking about pathogenic water, right? This unmetabolized water in the kidney or the lower burner. So that's something that was said about Mahuang, I believe, also in the Qing Dynasty. And so oftentimes, like this is like a Mahuang Fuzi Xixing Tang pattern, what you'll see is that in the Chi pulse, especially on the left side, Often that pulse can be fairly long, and it can also be tight. Okay, and you might see not too much happening in the guanzhi. Those pulses might be fairly weak as a result, because all of the body's resources are devoted to attacking that pathogen that's in the lower burner. So it's devoting all of its resources to that chi area or below the chi. And then same with Fuzitang, but Fuzitang often is more on the right chi. Typically more of a like a semi-weak but also a little bit tight pulse on the right chi as well. And there might be a little bit of a floating right guan as well. So going next up, we're going to talk about how do we, in Australia, we can't use Mahuang, we can't use Fuzi. So what the heck are we supposed to do when we see these kinds of patients that have what you could call like a deficient exterior contraction, like a Shaoyin kind of conformation, right? And so there are ways to address this without using Mahuang Fuzi. So we'll talk about that coming up next. All right, so how do we replace Mahuang and Fuzi in these kinds of situations, right? Well, now of course the easiest way is just to use Du Tang, right? That's a good um, formula that I think it can stand in to some degree for these other herbs. I mean, it's not perfect, but it's very good. And so if you don't have access to single herbs, I would just use Tang. What we're going to talk about now is this using single herbs and trying to understand a little bit on a deeper level what each herb does and how to replace it. Now, in my opinion, uh, Mahuang is much easier to replace than Fuzi. Fuzi, we can also replace it, but it's a little bit harder. Now, we have some great resources that we can use to think about how to replace these herbs. One is Lu Chonghan, and this Lu Chonghan is from the fire spirit lineage from Sichuan, and they don't use Mahuang. They just think it's too dangerous of an herb to use, and so they don't use it. And then they didn't use Fuzi for even though they're the fire spirit school. There's a period of time where they didn't use Fuzi because the quality of Fuzi was quite bad in Sichuan for quite some time due to the way that they were processing it. So in terms of Mahuang, we have a very, very clear picture of how they replace it. They replace Mahuang with Cangzhu plus Chenpi. Now that Chenpi, um, sorry, that Chenpi has to be, in their opinion, it has to be a fresh Chenpi. It has to be a little bit. It can't be like aged for 5 years or 10 years. It has to be maybe newly processed Chenpi. The reason for that is because newly processed Chenpi will have a lot more of the aromatic contents have not broken down yet, as they would in older, 5, 10 year Chenpi. And so it still has the ability to produce sweat. And Changzhu can produce sweat as well. So for that, that's easy. That's Mahuang. You can just use these two herbs if you can get a hold of this kind of Chenpi. If not, just use Changzhu. Now, and the important thing is that the Changzhu especially, it'll also have that ability to touch the lower jiao because it's also a root herb. Okay. And so an example of this using this style is a formula from a book called Mayin Zhengzhi, which is a book that does it classifies various formulas according to pulse. Now, this book, this formula is specifically for a strong, tight, wiry left pulse, left shi pulse, okay? Just like we were talking about before. And so you'll see what it uses is 独活长足防风细心传承甘草. This is another great formula that you can try if you see this, okay? 独活 is very, very important in this. Okay, 独活, again, it's a root herb, but it can also effuse. That's the equality of all of these herbs. They can root down into the lower burner, but then they can also effuse out to the exterior. Okay, push that pathogen out, that cold and that damp and that wind out. And so that's the same with Shixin. I'm not sure if you can use Shixin in Australia. Maybe if someone can write in the comments, or we can talk about it afterwards. If you have the ability to use Xixi in Australia. But Feng Feng again is something just my teacher was just recently talking about how Feng Feng can also reach deep into the interior. And so it's another herb that you can use when there's a left shi that's wiry and tight. Now again, this formula also has for serious cold, you can add Guizhi and Jiang. Okay, so Jiang being Ganjiang, Sengjiang, all good depending on the situation. Obviously, Ganjiang is more interior warming. So if the patient has, for instance, sloppy stools, Sengjiang is more for the exterior. So the person has aversion to cold, or if additionally they have, for instance, nausea or rhinorrhea, obviously, then Shengjiang will be a good choice. And these are more Guizhi and Jiang. Both are more affecting what we could say the upper burner and the middle burner. Guizhi, we don't really think about it as penetrating deep. Obviously, it can, like for instance in Wuling San, it is doing that to a degree. But in this context, we're thinking of it in terms of the exterior, in terms of that left cun or that overflow pulse on the left cun. Okay. Now, what do we use for Fuzi? Well, you can use Rou Gui and Du Zong, especially in the case of if the patient has back pain, Du Zong is a very good option. Okay. Du Zong is a very good option. Now, if the patient has like more of a this would be if the patient also has, for instance, like on the right shi, it's either weak or sort of thin, but also a little bit tight. You can use these warm supplementing herbs like Rou Gui, and then add on to that Duzhong was also a young supplementing herb. Now, on top of that, another really good herb you can use Wuling xian. Wuling xian also affects more the left shi than the right shi, but it's also very good at penetrating deeper into the collaterals we think about, which is, for instance, if we have a long-standing illness, that's very, very important to use, okay? And it can also effuse outward. Now, another little trick that I thought of that is actually pretty cool, in my opinion, is for Fuzitang, you can just use the other herbs in Fuzitang. So that's Baizhu, Fuling, Baisao, and Rensen. Skip Fuzi, but for Rensen, you can use Gaolishen because Gaolishen has Fuzi in it. And I assume you can get Gaolishen. Maybe they just don't know about the fact that Gaolishen has Fuzi in it, but it does. And that's why it's so warming, is because it has Fuzi. And so that would actually have a similar effect to Fuzitang. So that's a really good move. Now Fuzitang is really more on the right shi. If it's the left shi, you have to add something like 独活 长竹 Tang, something that can diffuse outwards, um, or the patient will not get better. For rou gui, we want to use the Shangan gui. So Shangan gui is just Vietnamese cinnamon. And so as you can see, it says to strongly supplement Mingmen fire when the right shi is weak, when yuan yang is cold and vacuous. That sounds a lot with damp cold accumulating. And so that sounds a lot like Fuzi, right? The only problem is rou gui is the trunk of the tree, so it doesn't have that same affinity to the deep sort of the lowest parts of the body in the same way that Fuzi does, because Fuzi is a root. That's why it's good to add some of those root herbs. And the difference between Gui and other kinds of cinnamon is quite remarkable. If you get a chance to taste this kind of gui, it's really so much better. And so it's not really worth it to use gui if you can't get gui, in my opinion. It's just not going to have the same effect of this supplementing this Mingmen fire deeply below. It's really quite different than the cinnamon that comes out of China. So that's definitely something to keep in mind when you're sourcing your cinnamon. Duhuo we talked about, yeah, it's on that left shi, which is long and tight. It's an important herb also in Qianjin Sanhuang Tang, which has Mahuang, Huangqi, Huangqian, Xixin, and Duhuo. Another important formula for the lower back pain. And for Duhuo, you can use 15 to 30 grams. For rou gui, a sangang gui, you would want to start at 3 grams, because a problem with rou gui is that it tends to cause like a heat flare a little bit more easily. Again, probably because it's a trunk of the tree as opposed to the root of the tree. And so that's just some other information. Hopefully that's helpful for people when they're trying to substitute a different herb besides Mahuang and Fuzi. I think for Mahuang it's very easy. You can really get away without Mahuang in a lot of situations. I mean, the fire school never uses it. So Fuzi is a little bit more difficult, but it's also doable. Sometimes you just need to use a higher dose, especially of these like root herbs, like the duhuo, niuxi, sangji, shen, duzhong, these kinds of herbs. So hopefully that's helpful. And after the talk, we're done with the talk now. If anyone has questions, please feel free. Hopefully you've been already writing down your questions as the talk has been going on. And now we'll move on to have a little bit of a Q&A. All right. Well, thank you guys. If you made it this far, thank you. Thank you for watching. I tend to be a little bit long-winded in my talks, but hopefully you got some good information out of this. And if you liked it, make sure to check out the book I translated on Lo Shaokun and his Jingfang case studies, and also check out all the other great work we have at the Purple Cloud Publications. All right, thank you.